and we're so glad that everybody's coming out to see us. One of the highlights that we have is the University of Iowa Hospitals and Clinics Air Care helicopter service has just landed here on the hospital property and is open for tours for everyone. We'd like to just get some shots of this and see the people who are checking it out and learn a little from the people who are on this service.
How are you doing today?
I'm doing really well. How are you? Good. Would you like to explain a little bit about your service for us here? You're live.
This is the university's helicopter. It's a new helicopter. We got it, let's see, a year ago in the fall. Single engine helicopter, not the biggest EMS helicopter, but certainly fills our needs. We fly with two nurses and two nurses, a patient, and the pilot. We are based out of Iowa City. It takes us about 30 minutes to get to Fairfield. Pick up trauma patients, cardiac patients, stroke patients, anybody that needs a quick trip to Iowa City. We can provide that for them.
We understand that you're working on a project where you may be starting to have physicians ride with the helicopter service. Is that accurate?
Right, we already do that. We have a new medical director, Azima Med, and he flies with his scheduled shifts, and another emergency room physician flies with us with some scheduled shifts, and all the emergency residents, there's a new emergency residency program at the university, and as part of their training, each one of them will fly with us for currently it's a month, and that may extend, but currently it's a month.
That's really a good idea, so that they'll know from the get-go, because you fly right to the scenes of major traumas too. Plus, getting to know some of the rural hospitals and how things function as we work our best to stabilize patients and prepare them for your service. Looks like you have some riders already.
Yep, we got some kids in there checking things out.
Hi there.
Hi.
Have you ever been in a helicopter before?
No.
No? How does it feel?
Good.
Good. Do you like it?
Yes.
How about you?
Yeah.
Yeah, that's pretty nice. Well, you're getting your picture on TV right now. So, I'm glad you don't have to ride in this helicopter. We're glad that you're healthy and not hurt. Okay?
But we get to fly an airplane.
Okay, that sounds pretty good. How about you kids? Are you waiting to look inside the helicopter?
Yes.
Okay, what do you want to see?
You be flying it.
I don't think you can fly in it today, but you certainly can get in and look. We're going to go around to the other side now and see how it looks from that angle, okay?
Okay.
It's your turn.
I'm not very photogenic.
Oh, it's fine. So, you're with the Air Care helicopter today. Tell us a little bit about you.
My name's Kevin, and I'm the pilot. And been with Air Care for about a year now.
And what's your background, Kevin?
Well, I flew for Air Care for 8 years, then I left for 5, and then I came back.
Okay.
So,
okay.
Retired military. Been flying EMS for about 15 years.
Well, I know that speaking on behalf of those of us in the rural communities, we're so grateful to have this kind of service readily available, a very high quality, very skilled, and very safe service that we can count on to transport our critically ill patients to university hospitals. We know that we can't provide everything in Fairfield, Iowa, but we can certainly do many, many things to get everybody in the best condition to fly.
That's right, and that's what it's all about, rapid transport for the critically injured and ill. So,
that's right.
And we appreciate you utilizing our business.
That's right. We have many contracts with the University of Iowa as far as the state of Iowa requires a trauma registry of every healthcare facility. And our liaison is directly with our University of Iowa, our closest facility, and of course they are the highest level of care facility that the hospital can be in the state of Iowa. Our state trauma system is very rigorous in their requirements, and we're very proud here at Jefferson County Hospital to have met all of those requirements and passed them with flying colors. We even have received commendations for the trauma services and the interventional emergency services that we provide. How would you like to see the other side now?
Take off. Look at that. Fly up. Fly up. Hello. Fly up. Freedom. A little bit higher than this helicopter. A little bit above my head.
Hello, what brings you to the health fair today? Hello, Liam, how are you? Are you coming to see everything today? And you have a helicopter.
He loves helicopters.
That's nice. And a whistle too. Good. There are many, many fun things inside today for children. We hope you'll come in and try everything.
Yeah, we will.
I think it's time that we go on into the hospital and start showing you a little bit about all the other services and the booths and offerings that are available today. Today we have Sheriff Droz with us at his booth, and his attention is focused very heavily in our county on our drug problems and all of the things that they do to try to intervene. Can you tell us a little bit about it, Jerry?
Yes, right now with the pseudoephedrine law, it has dropped tremendously. As you can see, we've only got 5 meth labs in the county since January. What we're focusing now on is how it's coming in and different aspects of the way it's getting here now, because we've pretty well slowed down the meth making here, but we still have a problem in the county.
Well, that really improves our safety, because those of us in healthcare know how very dangerous the meth labs are. The potential is a very, very harmful setup, but of course the drug is a very, very frightening drug. Can you talk a little bit about it?
Yes, they'll get on drugs, and basically you see them as just like we do. They're real paranoid and have no idea, and they'll say, "Oh, look over there. There's a guy with a gun." You can see it's a blank wall, and you deal with that. We deal with that. Public deals with it. Private citizens deal with it. They don't know what to expect out of these people, and it's just dangerous not only for you folks but for the general public and us.
And methamphetamine is a very addictive drug. We have a number of drugs available, and I think you even have examples with you today.
Yes, we got some look-alike drugs here of meth and marijuana. So that's just the look-alike meth and then marijuana. Many comments has been made today about if it's white, they thought it was more white. What that tells us is they've added bleach to it and bleached it out white to make it, quote, pure.
Pure white.
Pure.
And you have evidence of a lab. Can you tell us about this lab?
Yes, there's everything here to make meth, with the exception of anhydrous. You've got the pseudoephedrine pills in different forms. We have the Drano in different forms. We have the starting fluids. We have the salt. We have the lithium batteries. We have the generator, the pill grinder, and different utensils used to make meth, the glassware, different hoses to get the anhydrous from the nursing tanks to the containers such as this that they'll transport it in. There's several methods of transporting it. Then also we've got a red phosphorus method now that's out, and we've seen a couple of that in the county already. And you'll notice up here at Dubuque, they've had 5 already this year, so that's something they're doing. But as soon as they took the pseudoephedrine out, that helped us tremendously at slowing the labs down. Now we've got to focus our things on getting the kids around, and
yes. We thank you and your group for everything you're doing to help make our lives a lot safer here. And now you have some people who want to learn about this.
Thank you.
I see it's on. Indian Hills Community College has a large nursing program. We here at Jefferson County Hospital are so blessed in that we're one of the clinical sites for our nursing students. We have a number of them with us today. Right here we have Ashley, and Ashley is helping people learn about poison control. Can you tell us a little bit about what you're doing?
I'm handing out brochures for the poison control. We've got a chart here of different chemicals that can be mistaken for just household products like juice. You would never even think, or bleach and milk can be mixed up for kids, or marshmallows and mothballs. There are brochures for your telephone. You could put one of these on the back of your phone or on your refrigerator, because you need this number handy at all times, because you never know how fast a child can start drinking something or eating something that they think is candy, or drink some bleach or something.
Everyone needs to know about poison control, and as much as everyone tries, we still see a number of cases every year in our emergency department. Thank you, Ashley, for being here. So we have a number of important missions in healthcare. One of them is prevention. Prevention requires knowledge on the part of people in general on things that they need to do to be sure that they're healthy. Linda Marley's here. She is our radiology department manager, and she's going to tell you a little bit about what her project is.
Our project is targeting mammography and the prevention of breast cancer through early detection. Our booth today has some information about breast health and how to take care of yourself, as far as doing the self-breast examination monthly, the clinical breast exam with your physician annually, and if you're over the age of 40, having a mammogram as a screening exam annually. And we just have a few booklets and information that we're giving away, as well as some information about our financial assistance program. We have a mammography assistance program that we have available for those that cannot afford to have a mammogram. So if you need information about this program, you can certainly give us a call, and we'd be happy to provide you with that information.
Thank you very much.
You're welcome.
Okay. As an adjunct to healthcare services in a county such as ours, often today people require very skilled care in their homes. They need professionals who can help them with that care and help guide the way. One of those care providers is Nadine Countryman. Nadine, would you like to tell them a little bit about your service?
Nurse in the House is a new home health care agency. We offer home health care services to 6 counties in southeast Iowa, skilled nursing services, home care aid services, homemaker services, and therapy services can be arranged for the individual counties for people needing rehabilitative services. We have an RN available 24 hours a day, 7 days a week. You can give us a call. We do free evaluation visits, and we're an excellent resource for people. 16 years of home health care experience.
Thank you very much, Nadine. Everybody eats. We're a nation of eaters, but we know that there are healthier choices available than many of the things that we try to get into every day. The fast foods, the high salt, high fat, the high cholesterol foods, they're all things that we are used to having but aren't the best choices for us. So the hospital is sponsoring a booth on healthy snacks. These are important things for people of all ages, and Mary Means is here. She can tell you a bit about it.
Well, caught me off guard. We're offering some snacks that are about a carbohydrate group for a diabetic, or 100 calories or less, and some newer choices that are low fat. Most of the choices are low fat, or the trail mix, which has raisins and nuts, which are good for your heart health too. So just to give people a variety of things to think of other than your traditional high fat foods.
Thank you very much. You're next. One of the booths that we're featuring today is demonstrating the surgical capabilities. You're actually in the ante area of Jefferson County Hospital surgery area. We have demonstrated here an example of the various positioning of instruments for a gallbladder surgery. Dr. Pittson, Dr. Richard Pittson, is with us today to tell you a little bit about it and the services offered here at Jefferson County Hospital.
Hi, I'm Dr. Pittson, the surgeon here at Jefferson County Hospital, and we're displaying the procedure for laparoscopic gallbladder removal. And we also provide a range of general surgery services and endoscopy and other office procedures. So it's been interesting for some of the reactions we get here, but they seem to enjoy it.
Thank you very much. Dr. Pittson is an excellent care provider, and we're very, very fortunate to have him here. We're going to move around the corner because we have a pretty active place going in that we're offering finger casts for children. You know, when children are injured, the time is very frightening for them often, and we want them to feel just a little more comfortable about what's going on if they have a broken bone and have to have a cast. So we'll come around the corner and see if we have some willing children here who would let us go ahead. There we go. Look at these fun kids who have come out to the health fair today. So, while they're getting ready here, we'll talk a minute with Mike Sellers. Mike Sellers is our bioterrorism coordinator here at the hospital. He works with all aspects of having us prepared in case of any kind of a terrorist type attack occurs, whether that's biologic, chemical, nuclear, or a wide variety of things. Mike's demonstrating today a system called the PAPRs, or the suits that can protect healthcare providers and others. Mike, do you want to tell us a bit about what you do?
Sure. What I'm currently demonstrating is called a PAPR. It's a powered air purification respirator. It actually blows air into the mask, inflates the suit, gives us a clean air supply that we can utilize. And while we're doing that, the Public Health Department has prepared a booklet that we have available for the public. Through hospitals, through the local public health services have that. To tell you what you can do at your residence, how you can prepare. It gives you websites and information that you can have to better prepare yourself.
Thank you very much, Mike. Now let's see what these children are up to. Hi, everybody. Have you ever had a cast before?
Nope. Nope.
Nope, and you're going to get one today, aren't you? How does it feel?
Slimy.
Does it feel slimy? Does it feel warm? That's right, because this kind of a cast gets very warm while you're having it put on. Have you ever had a cast before? Have you?
No.
Oh, okay, well maybe you can have a little bitty one put on today and you can slip it off very easily later.
We haven't.
And you haven't either. Okay.
I haven't.
Well, we have Laura Carey here, and she's working at putting on little finger casts.
I almost got one because I almost got my tailbone broke.
That would be a bad place to have a cast,
Yes.
wouldn't it? Yes, it would.
But I couldn't sit down.
Okay, we'll go on to another demonstration that we have going. We know today the single greatest preventive you can have to keep from getting sick is proper hand washing. You know, for instance, in the common cold, so many people believe that the only way you can get it is by people sneezing or coughing on you, but that is not accurate. It is transmitted by hands and hands to mouth. That's why everybody should be paying such close attention to wiping off the handles on grocery shopping carts and taking care of community telephones being wiped down regularly. We have a demonstration going today where people actually put on some lotion onto their hands, if you'd like to follow me, and they will rub it in and then wash their hands, and we hold their hands under a special light to see if they've been able to clean everything off. So we'll let you go ahead and watch. Not me. I see enough. This is Cheryl Royer. She's one of our nurses, and this is her project to help people learn to wash their hands better. Thank you, Cheryl.
Oh, yes. We know Dawn.
Dr. Reschle, we'd like to get some information from you. We have Dr. Reschle, his nurse practitioner Stacy Greiner, and David Armstrong, who's with one of our main providers of the actual implants. Would you like to tell us a little bit about this?
Gee whiz. We've got all of the works here, the hip prostheses and the total knee prostheses. We have some
Where do you implant the donuts?
Right here. So we even have some pictures of a procedure being done here. So we would encourage all the people to come over this way and take a look at these.
Even if it's not something that you're ready for yourself, maybe for your mother, your father, your grandparent, it's a good idea to it's necessary to have a much healthier, happier, mobile life. Have a special hospital. We know today it's so important that if you come to the hospital or if you go to the doctor or if you're traveling, that you have an accurate, up-to-date list of all the medications that you take. It's so important so that if you're not able to give that information, you do have it with you. Karen Shepard, our nurse manager from Med-Surg, is here today, and she is sponsoring a booth on making sure that people have these things available. Karen, can you tell us a little about it?
Well, we have a form that you can fill out in pencil, and it lists all the medications that you currently take, the dose, and the frequency. And then when you fold it up, there's a place for the tetanus and pneumonia vaccine and drug allergies also. It folds up small enough to fit in your billfold, and if you take it to the physician's office when you have an appointment, they will update anything that they've changed on it. And if you are admitted to the hospital, if you have it with you, it gives us the current information that we need to take care of you.
Should they have these when they go to their pharmacy too?
Yes, the pharmacies in town also know about these, and so if you have a medication that they're filling that isn't on the list, they would add it also.
Thank you very much, Karen. The next booth that we have at our health fair has to do with substance abuse, and it is aimed at helping to be sure that everybody is aware and informed about substance abuse in Jefferson County, Iowa. Let's talk with one of the providers for it.
Hi. Basically, what we're just trying to let everybody know is that we've got services in this area for people who are actively using or people that know people who are. So lots of information, a lot of agencies available.
Oh, we would be having our heads under the pillows if we thought that this is not a problem in Jefferson County, Iowa. Because it is a problem, whether it's alcohol or drugs, it is a problem, and it is affecting all ages of people. So we're really glad that you're here to help people learn about it. Thank you very much.
Thanks.
Another very special service that Jefferson County has is called the Nest. We have Tammy with us today, and we'll have her tell you all a little bit about the services she provides.
The Nest program is an educational incentive program for prenatal pregnant mommies and their children. Mommies stay in the program through pregnancy, and then for 3 years after pregnancy, doing some different prenatal things. They earn points for staying healthy. So by keeping their doctor's appointments, WIC appointments, those different types of things, parenting classes we have coming up, coming to the health fair, they get points for coming to the health fair. And they can buy different things in a little store we have, like diapers and baby lotion, wipes, those types of things. So they get education and they get incentives as well. We're funded by Prevent Child Abuse Iowa, so we do a lot of child abuse promotion. Preventing child abuse, the girls love it. They get CPR, the hospital works really well with us. We love Chris. So yeah, we have a lot of good things going on in the program.
Good.
If you're pregnant and you're interested, there are no income guidelines. Anyone can participate in the program. They can always contact us at CETA.
Good. Are you ever open for donations of things?
Absolutely, and that is one of the biggest things that we need right now. Prevent Child Abuse Iowa keeps the program going, but the incentives for the store we really don't have anything for. So we have different people and churches and organizations within the community who donate baby quilts and burp rags and diapers, different things like that. So donations are always very much appreciated and needed.
Well, thank you. Thank you for being here and for providing this.
Thank you.
When we talk about Easter coming up and new life, we're at a booth where that is their motto. We have representatives here from the Lions Eye Bank, and speaking as a healthcare provider, I can tell you that this is such an important thing, such an important service that we have, and such a high quality professional service for Iowa and other states as well. We're talking about the gift of sight. Can you tell me a little bit about your service?
Sure. I'm Deb O'Mara with the Iowa Lions Eye Bank, and we are the only eye bank in the state of Iowa. So we are a service that recovers eyes when someone donates after their death. We evaluate, process, and distribute the eyes, not only within Iowa, but also throughout the United States and sometimes internationally. And we work very closely and follow up with our donor families and with the staff at the hospitals who help with the donation process. And our booth today is actually for awareness of eye organ and tissue donation, because we know the great need for all types of donors in this country. And Jennifer is with us also from Iowa Donor Network. She volunteered to come down today.
Okay. Hi, Jennifer.
Hi.
Nice to see you.
You too.
And, I probably should not have said specifically just eyes, because I'll speak to you from my heart when I tell you that yesterday I was able to talk with a person who has been the recipient of a new heart, and how this person respects every second of life that he has been given. And we're not just talking about hearts, but many, many major organs. And we're blessed here too, because our University of Iowa is an excellent resource for the actual implantation of these. There's such a need, whether it's skin for burns or other tissues, bone, to help healing processes and major injuries. There's just such a tremendous need. And it is a gift that any one of us can give when we no longer need those things.
Absolutely true there, and the Iowa Donor Network is here to help facilitate that process. We do the recoveries state of Iowa, and we also do tissue recoveries across the state.
And we here at Jefferson County Hospital have helped with those types of things. And I think another message I would give each of you is that this isn't anything to be afraid of, that you don't have to be afraid, that the information is out, be well informed, and make decisions that are right for you and your loved ones.
That's right. Thank you. Thank you very much.
Our lives are so very busy today, and often that includes running here and there and everywhere, and we have to stop sometimes and think, as parents of children, as we're moving here and there, what can we do to be better teachers for our children? So we have Lynn with us today, and she's representing what parents can do. Lynn, can you tell us a bit about your project?
Yes. I'm representing CETA Parents as Teachers. We're funded through the AIM Empowerment Area here in Jefferson and Keokuk counties. And we have two programs. One program is for parents, and we can visit them in their homes, parents who have children 0 to 5. And we focus on developmental issues and milestones. And you'll notice at the table that we have a variety of activities that are very typical things you can find around your home to encourage children to expand their skills and development. We also have a program for child care providers. Heather Robinson is our representative for that, and she visits child care providers in our area, assists them with developmental progression, and also gives out handouts for parents of those children.
Okay, thank you. Thank you very much for being here and bringing these services to everyone's attention. Today, one of our booths is a homeopathy booth. Hi, can you tell us what homeopathy is?
Homeopathy is a natural system of medicine that's non-toxic and has no side effects. It's made from plants and animals and minerals, and it strengthens the entire immune system, bringing vitality on all different levels, mentally, emotionally, physically, and spiritually. And by spiritually, I mean the return of vitality, a smile from the heart, and an enthusiasm.
Well, those all sound like really, really good things. So you've brought a display with you today. Can you tell us a bit about it?
Yes, this is an old homeopathic family guide. Homeopathy
Yes, it is. Been around forever.
Yes, homeopathy is 200 years old, and it was started in Europe by a doctor named Dr. Samuel Hahnemann, who spoke and wrote 7 languages and translated medical texts in those languages. And then he discovered this system of the law of similars, which says that when you're treating someone who, for instance, if you have a cold with a runny nose and maybe it burns underneath and you're sneezing, if you give someone who's having those symptoms a remedy that mimics those symptoms, such as if you are peeling an onion, you may have runny eyes and nose and sneezing, then that remedy, Allium cepa, will cure that. So it's about kind of the hair of the dog that bit you.
Okay.
You know, the law of similars.
Good enough.
It's very effective. It's practiced in many different countries. There are 14,000 pharmacies in France that are homeopathic, and many hospitals throughout the world. And this hospital, Jefferson County, was a homeopathic hospital in 1900. And there's a kit downstairs in the glass case.
Cupboard.
Yeah.
Yes, there is. You're actually right. Okay, thank you for being with us today.
You're welcome.
Whenever a person experiences a loss, the event is surrounded by so many emotions, and there's so much healing that needs to take place. We have with us Bernita Pettit today, and she's representing 2 different groups here that meet at the hospital who deal with just this sort of a very sad, very difficult time. Bernita, can you tell us about your groups?
Well, we meet the first and third Monday nights here at the hospital, and we have a sharing time, a serious time for about an hour, and then we break up, and it's a place where people can just tell how they're really feeling, and nobody's going to laugh at them.
Thank you, and thank you for providing this service. And then going hand in hand with that, during lengthy illnesses that will mean the loss of someone, we have another service available here, and it's called Hospice of Central Iowa. Hi, can you tell us a little bit about your service?
Yes, we have an office in Mount Pleasant, Hospice of Central Iowa. We cover 9 counties in southeast Iowa, and we're a team of nurses, a doctor, social worker, home health aides, volunteers, bereavement program, social worker, and chaplain. It just goes on and on.
And your service is aimed at
providing quality life.
End of life
At the end
care.
of life care. Mm-hmm.
Right, and helping people stay in their homes whenever that's the decision that's right for them.
We like to keep them at home if possible, and
That's
make
good.
as many days good as possible.
That's right. Thank you so much.
You're welcome.
Oh, man. One of the greatest things about Jefferson County Hospital is the most wonderful auxiliary that we have. Our auxiliary is so dynamic, and they work so hard to help improve the healthcare services available to this county. So I'd like you to hear a little bit about it.
Hi, I'm Diane Hansen, membership chairperson, and our display here shows the many things that the auxiliary does. And one of the the proud thing I am most proud would be of the scholarships that are given each year to high school seniors and then also to non-recent graduates. To finance our endeavors, we have the bargain box and the gift shop, which are all staffed by volunteers. And so we have a very good volunteer organization, and that makes it work.
And work they do. I can't tell you enough all the things that they do for this community, not just for the hospital, but for the whole entire community. Thank you.
Thank you.
Jefferson County Hospital has 2 more blessings. One of them is our hospital board, who works so hard to help us with the direction to be able to be very forward-thinking and provide services to this county and community as it reaches out. The other thing would be our hospital foundation. The Jefferson County Hospital Foundation works so hard to provide education programs, funding, and support for all types of health and well-being projects. We have with us today some representatives of both of those organizations. Lori Woody, could you tell us a little bit about what you're doing today?
Well, this represents the hospital foundation, and the foundation has given defibrillators to several of the organizations, and they have just collected lots of money for lots of good projects. The main thing, I suppose, is the van, the courtesy van, which happened last year, or was it the year before? And I've heard a lot of good compliments on the van. But we're here giving away measuring spoons and pens and balloons to the kids and having a good time.
Popular booth, I'm thinking. We'll see if we can talk to a couple other of the representatives here. John Stever, can you tell us a little bit about what you're doing?
We're filling balloons.
Well, I know.
And looking good and handing stuff out and talking about the foundation.
You've been on the foundation since it started. Closely so. What have you been the most proud of working with?
I think it's just neat to see all the different ways we can help the hospital. I think the defibrillators are probably the thing that I think the most of. And I was glad we were able to help provide those to the schools and the fire department and the sheriff's office. So I guess that's one thing that sticks out in my mind.
Very good. We're awfully glad to have you and everything that you do. You have a couple other prime balloon blower-uppers here, don't you?
We do.
Larry Pettit.
Yes.
Larry, you have been a member of the foundation for how long?
Since last fall. I believe I'm the newest member of the board.
What do you like best about it?
I think it's a wonderful cause that the foundation has been able to generate funds to help with to purchase defibrillators for all the schools, all the sheriff, police cars, have law enforcement. It's probably one of the biggest things that the foundation has been able to do so far, and we have grand plans to help with additional equipment with the new hospital facility.
And we're pretty excited about that. I think the hospital van has been a huge asset too for us. And you're working here with Dr. Joel, and I'm assuming you're not messing with the helium today.
No, we're not breathing
No.
yet.
How about you? What do you like best about working with the foundation?
I like to see the community support. As they've already said, with the defibrillators and the schools, as well as the ambulance support with Batavia coming on board recently.
That's right.
And the courtesy van's been a great hit.
It's been a great help to people who really don't have another way to get here easily. So it's a very safe way, and we really appreciate it. Thank you. Hi there. Hi. Oh, I'm sorry, doll baby. Oh my gosh, it's pretty, isn't it? Pink. Well, let's see here. Child seat safety. I'm a mom and I'm a grandma and I'm an ER nurse, and I know the tragedy of caring for children who are injured. I know the tragedy that exists between children who are injured who have been restrained properly and children who have not been restrained. We have a member of our Iowa Highway Patrol with us today, Yvonne Olensalen, who's going to tell you a little bit about it, and I'm so grateful that Iowa now has teeth in the law.
Thank you, Joanne. Well, we do continually support legislation with the restraining of young children and adults in the car. Iowa just changed the law as January 1st, where children under the age of 11 need to be buckled up, or regardless of position in the vehicle. There is legislation introduced now to increase those ages, but it's very important. As you can see, I have a sample here of a car seat that was taken out, removed from a crashed vehicle, 11-month-old child, and was buckled up, and they did survive.
Yes. That's the answer. They survive, and their injuries are minimized compared to those who are not, who are ejected so often from vehicles when they're not restrained. So we're really glad that you're here today, and we're really glad that you are carrying your message across this state.
Yes, and we have anyone who has a question about whether or not their seat is properly installed, they can call any of the Iowa State Patrol offices. There is usually a technician, or they can put you in touch with technicians who can help you with the placement of child seats or check the child seats for you. It's a struggle sometimes.
I know. I've turned into an engineer now that I'm a grandma, and the newer 5-point seats are out there and available, but I know every place I buckle is important.
Exactly. They do have to be snug enough so that there is minimum play in that, so that the seat will do its job. And we also tell people you don't have to get the most expensive on the market. There's 3 criteria: what fits your wallet, what fits your car, what fits your child.
Okay.
All child seats, meet the same federal standards, regardless of price and looks on them.
Okay. There is something that I'd like you to address at this time of year. I know in my own case, I have a little grandson who has a very bulky winter coat, but we're having warm days now, and there's a big change in the fit of the car seat.
Right. What we do recommend is when you are putting your child in a car seat in the wintertime, warm the car up a little ahead of time so you don't have to put that bulky clothing on, those snow suits on the infants, because it does take away the tightness of the straps against the child's body and will actually not be as effective. It's just like you putting your seatbelt on, you want it snug. And you may have to do some readjustment with the summer weather because you're wearing less clothing, less bulky clothing. So there might be a little bit of adjustment on those 5-point harnesses.
I just want people to really think about that and take those extra minutes to make those adjustments.
The few extra minutes that a parent takes now is going to save moments of agony later on.
That's right, and parents can be very comfortable with their driving skills, but it's the other drivers they have to watch out for.
Exactly. We all have to be develop kind of a survivor mentality, and by being a survivor you have to be prepared and plan ahead and be defensive.
Well, thank you for being here with this important message.
Here, thank you.
We're trying to care for whole people, but we have special emphasis on certain body systems. Today we have Beth. Beth is our respiratory therapist, and she is helping people learn about the respiratory system. Tell us, Beth.
These are pig lungs, if you want to come in close and take a look. Pig lungs and human lungs look exactly alike, so this is about the size of a 200-pound man's lungs. They're kind of deflated because there's no air in them, so think of them as twice this size, pinker and puffy. This white tube right here that is pretty squishy is your esophagus or your food tube. It's just a hollow tube, and it hooks to your stomach right here. This darker tube back here is your windpipe or your trachea, and they follow along together. That's why it's so easy to get food down the wrong tube. This hole here is where the heart sits in the left lung. So that's why your right lung is bigger than your left lung. Then if we follow up here, this is your voice box. And right here, if you look, these white things are your vocal cords, and they just vibrate to make you noise so you can speak, or oink if you're the pig. So this would be your Adam's apple part right here. And this is your thyroid gland. So if you have thyroid problems, this is where it would be, or you have a goiter. So that's kind of it in a nutshell.
So we want people to take good care of their lungs. Yeah. They're not easy to come by.
No, and this was what I call a free-range pig. He lived out like in a pasture, not a confinement pig. Confinement pigs look like smoker lung pigs because they breathe all that confinement dust and methane gas. So, and your lungs are pinker than this, but since he's been lying out here since 8:30 this morning, he's getting kind of dark.
Okay, thanks for being here, Beth, and helping people learn about their lungs.
You're welcome. Thank you. Pig lungs and human lungs are exactly the same. So these are about the size of your dad's lungs. Now they don't have any air in them because he's not breathing, so think of them as bigger and puffier, okay?
What's your name, young man?
Caleb Durflinger.
Caleb Durflinger. Have you ever touched a lung before?
Yeah.
You have? Whose?
A pig's one from last year.
From last year. Okay, what do you think of that lung? Have you been out to see the helicopter yet?
Nope.
Are you going?
Yep.
Are you having fun today at the health fair?
Yep.
All right. Continue.
You want a wiper or are you going to touch me some more?
Knowing your numbers is a motto that we use in healthcare to help people understand how important certain parts of healthcare are. When you know your numbers, you know what your blood pressure numbers are, you know what your blood fat numbers are, you know what your weight is and what your blood sugar is. Marcia Kinsey is our cardiac rehab nurse, and her project today is to help people learn about their blood pressures and also their oxygen levels in their blood.
I'm gonna wear mine. Hey Ethan, you got me on TV.
Did that hurt?
No.
No. Did you find out what your numbers are?
Yeah.
Good. Were they good?
Yeah.
Very, very good. You take good care of yourself. So Marcia, I've been telling them a little bit about your project and what you're working on today. Any words of wisdom for folks?
Well, everyone should know what their numbers are. They should know what their normal pulse, resting pulse should be, their blood pressure, what their cholesterol and their LDL and HDL should be, so that they can know whether they're healthy, and if they're not, they can start working to fix it today.
That's the beauty of today's medicine, is that we have a lot more that we can do to help alter problems before they become a really big out of control problem. Thank you. One of the services available at Jefferson County Hospital is massage therapy and reflexology. And would you like to tell us a little bit about those services?
I'll tell you most about reflexology because that's primarily what I'm involved with at the moment. And everybody knows how, you're gelling.
Yes.
When your feet feel good. To steal a phrase here, and if you get your feet, you sleep better if you have a foot massage. The other thing is that on the bottom of your feet is your whole body. And it's hard for some people to believe, but if you think about what it's like when you wear bad shoes for a week, and if that hurts your back, then you know that your feet have something to do with the rest of your body. So if you massage your feet, then your whole body just kind of relaxes.
And we expect a lot out of our feet. We expect them, no matter what we do to abuse them, to carry us everywhere we want to go.
Yeah, if you gain that extra 5 pounds, they're working even harder.
And we do very little preventive maintenance on our feet.
It's true.
Take care of them, so good.
As you get older, you know that.
So
they hurt.
People can have an opportunity to see how good it feels if they stop by your booth today. Okay, good. Very good. Good. So when we're learning about numbers and learning about taking good care of ourselves, one very, very important thing is to know about our greatest single preventable health hazard in America today, and that is the use of tobacco. We have our tobacco prevention group with us today, helping people learn about the dangers of tobacco usage. And we're very proud here at Jefferson County Hospital in that starting July 1, we will be an entirely tobacco-free campus, knowing that we need to put that message before people. So let's see what's happening at this booth. Can you tell us a little bit about what you're doing today?
Well, we are asking our the people who walk by questions, and if they get the questions right, they get a prize.
Okay.
And one of the big things is this is how much tar would be in your lungs for smoking a year, and that's gotten to some of the kids.
Smoking
about
1 year?
Yes.
And how
one
much
pack,
a day?
1 pack a day.
1 pack a day
Yeah.
for a year would equal that much tar
on your lungs.
deposited in those bright pink puffy lungs that we just saw as we're doing our taping today. That is a very, very important message that you have there, because we do know that tobacco use, again, is our single greatest preventable health hazard in America.
Yep, it's the most addictive. So.
It is very, very and addictive in many, many ways.
Yep.
So we're very glad that you're here to help with this. Thank you.
Thank you.
We have some very special people with us today, and they're representatives of ARC, of Jefferson and Van Buren County. These are stalwart warriors who work every single day to improve the lives of people with disabilities. And one of the people that I have known forever who has worked with this and probably invented it, actually, is Darlene.
Started it locally with some help. Yeah.
Tell us a little bit about what you're doing.
Okay. Well, a lot of things, I guess. Special Olympics is one of our, we fund most of the local participation in Special Olympics other than the basketball skills, and the Optimus Club does that, and camperships is a big thing. We probably fund, I was going to say anywhere from $9,000 to $10,000 in camperships each year. It was higher this year than it's ever been before because we've actually sent a couple of them to Camp Sunnyside. Most of them go to Camp Courageous of Iowa, and we have brochures here at the table for that, and brochures on all the other stuff. And it isn't Arc of Jefferson and Van Buren County, by the way. It's just Arc of Jefferson County. The Van Buren part of it is Jefferson Van Buren Mental Health Coalition, and we have a kind of a joint booth situation here. And that, in fact, we have a new mental health resource booklet that we just now got printed, and anybody that might have some association with people involved with mental health concerns, and that could include people with mental retardation and developmental disabilities, by the way. We have a new booklet for that, so and they're welcome to it.
We're really glad that you're here today providing this information to people, and we're just very grateful for everything you do for our community.
Well, thank you.
Thank you.
Appreciate it.
So we've been talking this morning about how important it is that we have our site and that we have donations to help improve other people's sites when we visited the Lions Donor Bank. But this is another arm of the local Lions Club and of Lions International. Lions International, as I understand it, has a major focus in prevention of disabling eye disorders. And today we have a crew of our stalwart local workers headed by Bob Keller, who I might also add is chair of the hospital board. And they're working with children, I think.
That's correct. We're taking pictures of preschoolers' eyes up to 5 years old.
Okay.
And these pictures are sent in to Iowa City, in which they're read, and then if there's a problem, they receive a letter back stating they need to go see a local eye doctor or whatever.
Do you have to use a special type of camera to do this?
Yes, we do. We have a special camera that's designed just for this, and it has a few things designed into it to make it easier for Lions members to take the pictures, as well as to make the child sit still and help get the picture taken properly.
I think that Iowa does such a wonderful job in dealing with these things. Do you have a comfort dealing with your resources at the university on these issues?
Yes, we have a very good comfort and a very good level of participation for this.
So parents should not be afraid to bring their children to have this kind of testing done.
Oh, absolutely not. In fact, every parent should have this done to their child because they can find problems like lazy eye and other issues that they wouldn't even know until a lot of times it was just a few years ago that kids did not know this or parents did not know this until the child was halfway through school.
Yes, and we know that their opportunities for a good outcome increase the earlier you can find it.
Exactly, it definitely does.
All right, and who all do you have with you today helping with this?
Oh, I have my wife Mary, and I have Lane Bush and his wife.
We'll try to get Lane out here.
And we have Carl Watts.
Okay, we'll get his picture too. But Lane Bush was just the recipient of a very important award that was featured in our ledger, and we'd like to just publicly congratulate you for receiving that eagle. We're very proud of all you've done, not only with the Guard and with the military, but he has always here for the Lions Eye Bank and the Lions Group with whatever you do. We have some folks over here, and you're welcome very much. And there is that's an added benefit, I'd say, right there. I was speechless for a moment. That's the best. So we'll get some children signed up here and get them checked. Thank you.
Thank you.
Good job. Oh, look at this little sweetie. Got one little tear. Diabetes is a disease that affects millions and millions of Americans every year, and it can be a very disabling disease. Chris Esteltedro is our education manager here at Jefferson County Hospital. She has a special interest in the diseases of diabetes, and she's going to take you around to several booths to tell you what's going on today to help people learn about how important it is to know about these diseases.
Thank you, Johnine. As Johnine said, diabetes is on the rise. I have several vendors here with us today. what I'm doing today is just handing out some patient information about diabetes, the importance of monitoring your own glucose, and the importance of following up with your physicians. Alan Rath is our freestyle monitor representative today, and we'll be talking with him shortly. If you have any questions related to diabetes, or if you'd like any information sent to you, you can call the Hospital Education Department at 469-4232, and I'll be happy to send you some information or answer any questions. We'll go talk to, maybe we can find JJ with Lantis. With me today is Alan Rath, our freestyle monitor representative, so I'm going to let him talk a little bit about his product. And thanks for coming, Alan.
Sure, thank you.
Yeah, you bet.
Basically, I'll just talk a little bit. I'm actually with Avid Diabetes Care. We make the Freestyle brand. We make the Freestyle and Freestyle Flash. If you want to know about our product, you can go to I guess if you have a website access, you can go to aviddiabetescare.com. But in a nutshell, Freestyle is basically it's a popular meter because it's virtually pain-free. It's got the smallest sample size of any meter. It's about the size of a pinhead. And we have some exciting products coming out in the future for testers, which we hope to have out this year. And that's about. What else do you want me to talk about?
How many, when you do these types of events, how many people do you think are using your monitor? Is there a lot of people that are using this new monitor? And how long has this monitor been on the market?
Freestyle's been out actually probably, I'm going to say 6 years.
Okay, so it's been out for a while.
And Freestyle Flash has been out probably about 2-3 years.
Yeah.
And there are quite a few people using the Freestyle brand, and it's growing.
Yeah.
Quite rapidly, actually. So.
Thanks, Alan, very much.
Yeah, thanks for letting me be here. Thanks.
Yeah. Okay, so with us today we have JJ. She is our Sanofi-Aventis representative, and one of the products that her company manufactures is Lantis, which is an insulin that lots of diabetics are using today. I'll let her introduce the people that are with her today. Thanks, JJ, for being here.
Thanks, Chris.
Yeah.
It's good to be here today. And I want to introduce you to, this is my counterpart. This is Sarah Lands. And then I also want to introduce you to Greg. He's actually out of Virginia, and he is actually an A1C champion for us, which means for diabetes, goal would be your A1C under 7. And so he is in from Virginia to talk to us about that today. So we'll let him say a few words about that.
Thank you. What I do is part of Sanofi-Aventis. They underwrite a program for us to travel around the country and teach people the value of an A1C and how important it is, being that I've lived through it myself. So I bask in their greatness over here, and I'm going to let Sarah tell you a little more about the pharmaceuticals that actually work to help, the tools that help me keep my A1C down.
Thanks, Greg. Basically what we're representing here today is Lantis and Apidra. Lantis is a basal insulin. Apidra is one of those insulins called a rapid-acting insulin that'll work at meal times. And those two together, I know Greg has experienced this, have really helped to, in combination, get a lot of diabetes under control. And I think that's about it. So thanks, Chris.
Thank you so much for having us.
Thanks, you guys, for being here. With diabetes on the rise, there's been lots of people through with lots of different questions about monitors and insulin preparation. So thanks, you guys, for answering all those questions.
Thanks, Chris.
You bet. Okay, so with us today, too, we have Steve Schneider. He is our LifeScan representative from Johnson & Johnson, and one of the meters that many people are familiar with is One Touch products. So I'm going to let Steve talk a little bit about that.
Great. Thanks, Chris. Appreciate you having me here today. One Touch Ultra and One Touch Ultra Smart. One Touch Ultra, as many of you have probably seen this gentleman on TV, B.B. King. He represents the One Touch Ultra. One Touch Ultra Smart, insulin intensive therapy meter. You've probably seen Gary Hall Jr. He is our Olympic swimmer. He's representative for this, okay? One Touch Ultra, 5-second test time, small amount of blood and alternate test site. And this is the meter right here, okay? Ultra Smart, logbook in one. They can record before and after meal recordings. They can do health checks when they went to see the physician. Very all-encompassing meter. Usually when they come to the tables and I talk with them, we just basically talk about what they're looking for in a meter. Is it ease of use? Is it a small amount of blood? What type of material do we have? Anything we can do to help them test to make it easier for them, make their lives better, we're going to try to do that for them. Chris and her group do a great job with that. I assist them and do the best I can to help them. So I appreciate, again, you guys letting me come and assist and help out any way I can here in Fairfield and the community. So thank you very much.
Thank you very much. Good job, yeah. Good job. I just got to go do the students. So we're performing finger sticks on people that would like to have their blood sugar checked. It's relatively painless. Isn't it relatively painless?
Just a little
poke. A little poke, like a little bee sting, isn't it? And then what they do is they check their glucose to see what that reading is. If it's a fasting test, we like it to be between 80 and 110. Obviously, if you've had something to eat or drink, your blood sugar is going to be a little bit higher. So we appreciate the students being here. We appreciate people stopping in and having their fingers poked for that glucose reading. It's important to test several times a day if you're a diabetic and you're on insulin. So thanks you guys for coming. Thank you very much.
With us today, a person who can talk about some of the perils of this.
Hi, I'm with Alcohol and Drug Dependency Services in Southeast Iowa. Our office is located in Ottumwa and in Burlington, and we are responsible for 10 counties here in Southeast Iowa. We're affiliated with 1-800-BETS-OFF, and we hope to be spreading some information about prevention for problem gambling right here in Jefferson County coming up this next month or so. We have a variety of information for all different types of populations, and we'll be coming around to different places in the area and be in touch with the Chamber of Commerce and the City Council and as many places as we can possibly get in touch with to help talk about the dynamics of problem gambling and responsible gaming. It's an issue that we feel is very important and a very timely issue considering everything that's been happening around the Iowa in recent time.
Thank you very much. We're glad that you're here with us today. Thank you. Next, we have representatives from Sunnybrook Assisted Living. You know, as people pass through the various phases of life, there are times when a person doesn't want to have total care, but would like to have just the assistance of someone to help them with their care. And it looks like we have the whole crew lined up. And if we have someone who'd like to be the spokesman and tell us a little bit about what's going on with Sunnybrook Assisted Living.
And we also have Sunnybrook Home Care here, which Sunnybrook Home Care and Sunnybrook Assisted Living were started by David and Betty Howell. And this is Betty Howell. And Betty's mission was to keep people out of a nursing home as long as possible. And the assisted living and the home care both do that through providing all the services that someone would need to stay in their home or in their apartments at the assisted living. Betty, why don't you tell them more about it?
Well, Sunnybrook Assisted Living is a great alternative to long-term care. We have 24-hour supervision available, 24-hour services available. Home-like apartment settings. Our residents have their own apartments. They bring their own furniture. They're surrounded by their own environment, and they decorate that apartment however they like, with all the services that they need. So it's a great alternative to long-term care.
And they are spacious and they are very beautiful. It's a very beautiful facility. We're really glad to have it here in our town as another choice for people today. Thank you for being here.
How about a phone book cover?
Okay. So we have something just plain fun today. We have a group here doing face painting for kids. Seems like the kids always like to do that. And I think we have their sponsor right here if we can get a few words.
Hi, my name is Heidi Bowman. I am the coach of the Fairfield High School Dance and Drill Team. And today we are painting faces as part of the health fair.
How many of your crew do you have here with you, Heidi?
Today I have 4 of the girls of a squad of 13.
Okay, and it looks to me like all of the kids are having fun, and I'll bet you're all having fun too.
Okay, thanks.
Thanks for being here. Are you on? That's fine. We have a number of exhibits here today that are featuring some improvements for people in their lives, and we'd like to at least get them involved. Would you like to tell us who you are?
Hi, my name is Marcia Hansen, and I'm new to Fairfield.
Okay, and you're representing?
The O-Spa, Oxygen Spa.
Okay, and I hear it's supposed to feel really good.
It does feel really good. In fact, I liked it so much I opened one.
There you go. All right, and you folks are with Earth Wisdom, I believe. Is that correct? Can you tell us a little bit about it?
Well, I have two kind of divisions. Earth Wisdom is my own company. I make all herbal natural products. So I have a spray here that I'll spray you with. It's called Muscle Ease Mist.
Will you drop me to the ground?
Not immediately, but it'll help you relax.
Okay.
It's got menthol and camphor and eucalyptus and things that help. As they sink in, they'll help increase the blood
Smells
circulation.
delicious.
I also have natural heating pads that you put in the microwave, and they're full of cherry pits. And they
I
feel
saw
really
that
good.
earlier.
And then what do we have here? This is a company called Forever Green, and they have a whole variety of whole food, natural, pure, organic products.
Okay.
This one is called Frequency, and it's a tonic that is primarily made with phytoplankton.
Okay.
Little one or simple celled plants from the ocean. And there's all the materials, it's like the most basic component of life on the planet.
Okay.
So when we take...
Not everyone's happy at our health fair today, but we're working hard at it.
She must not have liked what they painted on her
No,
face.
I think you could be right.
I don't think she got there yet, and that's probably why she's crazy.
Yes. But anyhow, it has everything you need to rebuild on the cellular level of the body. So it edifies the body in every way.
Okay.
It helps with the skin. It helps with the liver, congestion. Many people that have had cancer have taken it, and it's helped the body maintain a better state of functioning.
Good.
So,
Well, your spray is just tingly and warm, a warm, tingly feeling.
I'm
Truly,
sure
it
that
is.
cameraman will enjoy it.
His poor arm's nearly ready to fall off today. Well, we thank you for being
Welcome.
here
Thank you
today.
for coming by.
Good.
It's been a very busy day.
All right, and here we have a display from the Fairfield Acupuncture Clinic. And would you like to tell us a little bit about the service that you provide?
I provide acupuncture service.
Okay.
And here you can see I put some acupuncture in his ears. You can bring the camera over.
And what are you working towards?
Towards relaxation and removing stress and removing blockages from the body. So if there's any pains or aches, we help the body to control them. What the acupuncture does, besides relaxing the body, helps to release endorphins as well.
And you've taken some special training?
I went to school for 3 years, got a master's degree in Chinese medicine, and a license in the state of Iowa.
And does it hurt?
Nope, feels good.
Doesn't hurt
Feel
at all?
relaxed, feel good.
Do you really?
Yeah.
All right. Well, did you want us to show us some of the things you use and as you do this?
Yes. You can see I use very small needles, as you saw it on the
And
ear.
they're single use.
They're single use, disposable. Take them out of a package.
So they are all sterile, not used before.
And very, very tiny, so you barely feel them when they go in. And it's good for any kind of health problem.
Okay.
Chinese medicine has been around for over 3,000 years.
That is absolutely correct.
It's been tried out on many millions and millions of people. Even in America, millions and millions of people are using acupuncture.
Okay. Well, we're really glad that you're here.
Thank you.
And that you are showing us what is out there. I know that we have local people who drive to the Iowa City area to seek this kind of intervention.
As of this month, I'll be starting to work at the Jefferson County Hospital.
Yes, that's right.
I will be here in the hospital.
So be here, and people could contact
the hospital.
The hospital here for information about your services.
Yeah, I'll be upstairs at the physical therapy.
Okay, very good. Very good. Okay.
There's also Fairfield Bodywork. But he's not here right now.
But he's not
he does
here right
massage.
now.
That's Tyson.
Okay. Oh yes, and we wanted to be able to see Tyson today. All right. Thank you very much.
Are you busy?
Oh yes, are you? It's good to see you. Hope you're feeling better. This is the acupuncture booth. They'll do some for you. One of the things that Jefferson County Hospital offers to help people stay safely in their homes is a program called Lifeline. We have Charlotte Peck here, our Lifeline coordinator, to tell us a bit about her program.
Hi, the Lifeline is a personal response system to help people stay in their homes a little longer than maybe they would otherwise. Sometimes the doctors will advise a person to have Lifeline. If they would fall and need help, they can push a button and it sends a message to the emergency room here at the hospital, and then we will send somebody out to help them. They give us a list of people that they trust to come into their homes, and that's who we would send to help them if they need help.
Thank you very much. We're mighty glad to have this service here. We know today, with the heavy use of the internet, that there are dangers. There are dangers to children, there are dangers to people in identity theft and communication and so forth. And one of our demonstrations today has to do with internet safety, making sure that everybody knows how to keep everybody safe when dealing with the internet. Another thing that we have is a representative of an exercise program. We all know how important exercise is, and we have the people here from the jazzercise class. Another thing that is offered here at the hospital are some therapies that can help people with their body image and with certain problems that they have. And if you'll follow me, we have with us today Wendy Bittner. Wendy is with Med-Laser Cosmetics, and we'll have her tell you all about the services that she provides right here in Fairfield, readily available for you. Hello, tell us a little bit about what you have going.
Well, thanks, Johnine. I'm here to let people know that, in fact, Med-Laser Cosmetics, originally in Ottumwa, is now coming to Fairfield twice a month, and we have clinic space here at Jefferson County Hospital, and we've been busy so far already since starting those services here in November. We do everything from laser hair removal to Botox injections, facial rejuvenation, and then we carry some wonderful skincare products that help with aging and other issues for young people as well, acne and scarring and discoloration. So we offer a complimentary consultation, and anybody's welcome to come and learn more about what we can do for them.
So you have the skin, it's called Skin Line of Care, is that what you call it?
This is Skin Medica, which is a new line of products that I've started to carry. It's available only in physicians' offices, and it really delivers what it promises. I've tried a lot of different lines, and this is the best one that I've found yet.
That's really a good thing and nice to know. What's your opinion about sun safety?
Sun safety is extremely important. We all know the risks that it carries as far as cancer, but one thing that we all don't want to do is age prematurely, and that's what the sun can do. We have a lot of products that are geared towards repairing the damage that's done from the sun and also preventing. Sunscreen is the number one product that you can use on your skin.
You know, I recently saw an article where the writer was touting that sunscreens are not okay, that they don't really help. What do you know as really our skin specialist here?
Well, definitely we know that sunscreen helps. It protects your skin. A lot of people are worried about chemicals in sunblocks or not getting enough sun, because we all know that some sun is healthy. But there are sunblocks that are options that do not contain chemicals that penetrate the skin. We call them physical blocks. People can look for zinc oxide, aluminum oxide. Those are two ingredients that block the skin by staying on the surface of the skin and not penetrating. So that's what I would recommend, that everybody needs a sunblock, but a safe one as well.
We're in agreement in healthcare on that, so thank you very much. Thanks for being here today. Great, and we're here to interview you and find out what you're doing to help kids today.
We're teaching fire safety today. My name is Sparky. I'm the fire dog.
We're so glad you came, Sparky. Did you get cold last night?
Oh, it was a little cold last night. I like this sunshine.
You know, we've had a lot of grass fires around here lately. Do you have any advice for people?
Yes, when it gets really dry, watch if you're gonna have a fire, watch so it doesn't get away. You shouldn't really burn when it's really dry. Keep an eye on those trash fires.
Now, how about for all of our kids? What's your best advice to kids?
Don't play with matches, kid.
I agree. And what do they need to know? Should they ever see smoke around home or see flames?
You need to get out. Go to safety. Go to safety, and you should have a meeting place for your family so you all know you've gotten out of the house safe. And call 911. Okay?
Oh, okay, kids? Who do you call?
911.
All right. They're good.
Hey, kids, also, it's that time of the year. We just went through a time change, okay? And we need to check those batteries in those smoke detectors, okay, ma'am?
That's right.
Check those batteries and make sure that they won't work unless they've got good batteries in them.
Everybody's supposed to do that when we change the clocks, aren't they?
Yes, they are.
Okay, thank you very much for coming today.
I hope we taught some fire safety today to everybody.
I hear you're a good driver, too. Are you going to drive around for us?
I can. You want to hear my motor rev up?
Wow, he's good, isn't he? Are you having fun at the health fair today?
Yeah.
What did you like best?
The airplane and that talking dog.
And the talking dog. How about you? What did you like the best? Don't know? You? What did you like best here today?
The dog and getting my face painted.
And getting your face painted. And you? What did you like?
Like getting balloons.
Getting balloons. And you remembered 911. That's an important phone number for all of us to know.
Don't play with matches.
Okay, thank you.
Thank you. Bye-bye.
These guys are about ready to come out of here. It'd be good to catch them.
Yeah. So can somebody, why don't you come and tell what's going on? Oh, we have with us the Packwood Fire and Rescue contingent of the Fairfield Fire Department. Is that correct? So would you like to tell us your name and tell us about it?
My name is Mike Myers from the Packwood Fire Department. Us in Fairfield and the Elks put this trailer on, take it to schools and stuff, and show the kids what to do in case of fire.
Boy, that's so important. We in healthcare know there's just nothing much worse than a bad burn.
Yep. And this thing they're giving a severe weather class right now to teach the kids what to do in case of a tornado or something.
Well, I'll tell you, last Sunday brought us all around, didn't it? And reminded us that spring is coming. And then I heard on the way in this morning that Tennessee was hit again with some very, very bad storms. So that is so important for everybody, not just children, to know. So we'll be having a class emerge pretty quickly.
Yeah, it should be done here in just a minute.
Okay. We have with us here at the health fair today members of the Jefferson County Ambulance to demonstrate the services that are available pre-hospital-wise for our community. Would you like to tell us a little bit about what you're doing today?
We're just getting people familiar with our ambulance inside so where they're not scared when we go pick them up by chance. And it gives them a feel of what we do, and I think it helps a lot.
Is this your brand new ambulance?
No, it is not. This is our second one, and we haven't got the new one out yet.
Oh, okay. We have a brand new ambulance about to arrive and be outfitted, so we're pretty excited about that.
We are. We just moved into our new building last Thursday, and everybody pitched in and did a lot of work, and so we're excited to, be in a different building.
Do you want to tell them where that is in case they need to? Do you have your offices there?
Yes, our offices are there. We house all three rigs, and it's south 17th Street, just south of Bob's Barn.
Okay, and this really is the first time I think in history that we've been able to have all the emergency vehicles housed under one roof. So that's an important thing, and it looks like you have some folks here who'd like to see what's going on. We'll let you go ahead. Thank you. We have with us Bill Luco, and he is one of the co-owners of our local Jefferson County Ambulance Service. Bill, you want to tell us a little about your service?
Thanks, Johnine. We do have a new location. We are going to be located on 111 South 17th. It's just south of Bob's Bar in there. We received our new ambulance. It came just at the end of last week. So everybody can expect to see that a couple of weeks to get our communication equipment put in it and get it out on the road. It looks something similar to our other rig, but it's new. And we enjoy working with you.
Well, good. And we enjoy working with you too. And we're all in it together to try to provide the best possible care to the people of this community.
Yep.
Okay. Thanks. Enjoy the health fair. All right. Bye. One of the very special services here at Jefferson County Hospital is our Living Care Center. It provides a wonderful opportunity for people who just can't quite make it in their homes. I have with me Marty Chandler. She is the nurse manager of this unit, and I'd like her to tell you a little bit about everything that's happened here in the last few months.
Sure. We have just remodeled our unit in the last year. We are a 36-bed licensed facility now as a nursing home, and we have remodeled our activity room. We've expanded it. It's larger now, and it's a lot easier for the residents to get in and out of. We've added chairs. The auxiliary has been very generous to us, and they have bought chairs for us, artwork. We have remodeled our rooms. We have made them put solid walls between most of the rooms so that they're private, and we just have tried to just make it hasn't been spruced up for many years, and we've just tried to make it a lot nicer for our residents, and we would love for you to come out and visit us. We have right now we have refreshments out here for people who'd like to come in and visit. So if you have any questions, we've got brochures now that give a little more information about our unit, and just welcome you to come in and visit us at any time.
We're very